and welcome back to your guide to COVID-19. In this video, we'll be discussing several COVID-19 treatments and some important facts that you should know about them. Let's get into it.
The first treatment we will cover is Rem Death Severe, also known as Veklury. Rem Death Severe is in fact the only COVID-19 treatment approved by the U.S. Food and Drug Administration, but that does not mean it is the only treatment used in hospitals. So how exactly does Rem Death Severe treat COVID-19? Well, Rem Death Severe specifically targets an enzyme used by the virus to replicate its RNA. When this enzyme's function is ruined, RNA replication can no longer occur, and the virus cannot replicate itself either, preventing its further spread. Remdesivir is administered to the patient by injecting a liquid solution into the patient's vein for 30 minutes to 2 hours. This injection can continue for 5 to 10 days based on the patient's personal needs. There are many benefits of using remdesivir, such as quicker recovery, lower death rates, and prevention of severe respiratory damage. There are also some drawbacks of using remdesivir, such as potential nausea, hypersensitivity reactions, and an increase in blood clotting time. The second treatment is dexamethasone. Even though dexamethasone has not been completely approved by the FDA as a COVID-19 treatment, dexamethasone is recommended by NIH treatment guidelines for some COVID-19 patients. How exactly does dexamethasone treat COVID-19? Well, rather than targeting COVID-19 virus specifically, dexamethasone targets and reduces the overactive immune response of some COVID-19 patients. Even though this sounds counterintuitive, by diminishing the overactive immune response, dexamethasone decreases some severe side effects that this response can have on the rest of the body. Dexamethasone can be injected through the veins or administered orally. Dexamethasone must be administered once daily for 7 to 10 days for it to have a noticeable effect. Some of the benefits of using dexamethasone are that it prevents damage to the body's organs by preventing an overactive immune response and results in a reduced mortality rate. Even though dexamethasone is usually safe, it can result in temporarily higher blood glucose levels and can worsen diabetes if the patient is already diabetic. The third treatment is convalescent plasma.
Notably, the NIH does not recommend for or against the usage of this treatment according to its treatment guideline. However, it meets the FDA's EUA, Emergency Use Authorization, guidelines, so it is allowed for use in the USA. How does it work? Convalescent plasma refers to the plasma, the liquid part of the blood, from a COVID-19 convalescent, or a person who has recovered from COVID-19. The plasma contains COVID antibodies which can potentially help a COVID patient fight back against the virus. How is it administered? People who have been officially diagnosed with COVID-19 and have recovered from it can donate their blood to trusted sources. Their blood can be processed so that only their plasma remains. The plasma can be injected into the patient to help them fight COVID. Potential positives include the treatment shortening the length of the disease in a patient and decreasing the severity of COVID-19's effects. Potential negatives include the patient experiencing an allergic reaction and infections being transmitted via the transfusion, such as HIV.
It is important to note that while remdesivir, dexamethasone, and convalescent plasma are all treatments for COVID-19, they are not cures or prevention methods.
We hope that you enjoyed this video and were able to learn something new about the COVID-19 pandemic. If you would like to see more videos like this, please be sure to like and subscribe. Also check out our Twitter and Instagram posted in the description. Thank you and see you next time!